You already carry a diagnosis: lupus, rheumatoid arthritis, perhaps Sjögren's syndrome. You and your doctors have been focused on your joints, your skin, your blood work. And now there is something new: a burning, a numbness, a patchy weakness that doesn't quite match the rest of your disease. You may have been told it's unrelated, or stress, or a side effect. In reality, your nerves have been pulled into a war that was already raging inside your body. I treat pain as a signal, and when a patient with systemic autoimmune disease develops nerve pain, that signal is rarely random. It is collateral damage from systemic cellular warfare. Today, we examine how diseases like lupus and rheumatoid arthritis damage the peripheral nervous system, and why this particular form of neuropathy demands a different strategy than the others in this series. In an autoimmune disease, the immune system has lost its ability to distinguish self from non-self. It attacks the body's own tissues. The joints and skin may be the headline targets, but the immune system is not precise. It produces a storm of autoantibodies and inflammatory chemicals that circulate everywhere, and the nerves are exquisitely vulnerable to being caught in that crossfire. The first and most important mechanism is vasculitis. Your nerves are fed by a network of tiny blood vessels called the vasa nervorum. In diseases like lupus and rheumatoid vasculitis, the immune system attacks the walls of these small vessels, inflaming and narrowing them until they close off. The nerve downstream is starved of oxygen and begins to die. This produces a very distinctive pattern that an astute clinician recognizes immediately: mononeuritis multiplex. Instead of a smooth, symmetric numbness, the patient develops sudden damage to individual. Named nerves in a scattered, asymmetric pattern, a wrist drop here, a foot drop there. That patchy, random map of damage is the fingerprint of a vasculitic autoimmune process, and it is a signal that should never be ignored. The second mechanism is the direct antibody assault. In Sjögren's syndrome in particular, autoantibodies, such as anti-Rho, also called SSA, are associated with a direct attack on the sensory nerve cell bodies, which cluster in structures called the dorsal root ganglia. This produces a sensory neuropathy, or even a sensory ganglionopathy, where the body's position sense is profoundly disrupted. Sjögren's is one of the most underdiagnosed causes of small fiber and sensory neuropathy in all of medicine, frequently missed because the dryness symptoms are mild or overlooked. The third mechanism is chronic cytokine inflammation. Active autoimmune disease floods the bloodstream with inflammatory signaling molecules. Tumor necrosis factor alpha, interleukin-6, interleukin-1. These cytokines are directly toxic to nerve tissue. They sensitize pain fibers, making them fire more easily, and they drive ongoing low-grade damage even when no single nerve is being dramatically attacked. This is why so many autoimmune patients describe a diffuse, body-wide burning and heightened pain sensitivity that tracks with their disease flares. These diseases reach the brain as well. Neuropsychiatric lupus can produce cognitive dysfunction, headaches, mood disorders, and in severe cases, seizures or stroke-like events, driven by the same vasculitis and antibody mechanisms attacking the central nervous system. The cognitive fog that autoimmune patients call lupus fog is not imaginary. It is neuroinflammation. In the periphery, the presentation depends on the mechanism. Vasculitis gives you the asymmetric, dramatic mononeuritis multiplex. Antibody and cytokine mechanisms give you symmetric burning, numbness, and small fiber pain. Many patients have a blend. What unites them is that the neuropathy waxes and wanes with disease activity, flaring when the autoimmune disease flares. That linkage is the clue that the nerve damage and the underlying disease are one and the same fire. Here is the honest, contrarian view. Some in the wellness world claim you can reverse autoimmune disease purely through diet and supplements, and that you should abandon your medications. That is dangerous. In active vasculitic neuropathy, immune suppression directed by a rheumatologist can be the difference between recovery and permanent paralysis of a nerve. This is not the place for ideology. At the same time, conventional rheumatology often stops at controlling the joints and labs while leaving the patient's neuropathic pain undertreated and the metabolic and inflammatory terrain unaddressed. The right answer integrates both: control the disease and rebuild the nerve environment. Work with your rheumatologist on the full autoimmune panel: ANA, anti-dsDNA, complement levels, rheumatoid factor, anti-CCP, and the Sjögren's antibodies anti-RO and anti-LA. If the pattern suggests vasculitis, a nerve and muscle biopsy or specialized nerve testing may be warranted. A skin biopsy for small fiber density can confirm small fiber neuropathy that standard nerve conduction studies miss entirely, and track inflammatory markers like ESR and CRP to monitor the fire. At Regenerve, we complement your rheumatologic care by targeting the nerve itself and the inflammation around it. One of our most powerful tools here is vagal nerve stimulation. The work of Dr. Kevin Tracy revealed what he called the cholinergic anti-inflammatory pathway, the discovery that stimulating the vagus nerve causes the body to release acetylcholine, which directly suppresses the production of inflammatory cytokines like TNF-alpha. In other words, we can use the nervous system itself to help turn down the autoimmune fire. We add cannabinoid-based therapies and PEA to modulate neuroinflammation and pain, intravenous glutathione to combat oxidative stress, and infrared light therapy and peripheral nerve stimulation to support healing and control symptoms, all coordinated with your specialists. Your neuropathy is not a separate, unlucky accident layered on top of your autoimmune disease. It is part of the same process, and that means it can be understood, monitored, and actively treated. Control the war, protect the nerves caught in it, and rebuild. If this connected the dots for you, share it with someone fighting the same fight. Visit regenerve.com or text 314-886-5902. I am Dr. Padda, and I will see you in our next deep dive.